Hi, I'm Dr. Eric Balcabbage and we're back for another edition of Methylation Monday. Today I'm going to talk about histamine intolerance, also known as histaminosis, and I'll probably spend the next few Methylation Monday segments kind of going over some of the nuances of histamine intolerance. Today I just want to give you a broad overview. I'm going to briefly explain what histamine intolerance or histaminosis is, why histamine is important, and some of the symptoms your patients may have if they have histamine intolerance or histaminosis. In general, when somebody is histamine intolerant or has histaminosis, essentially what they have is a condition where they're making more histamine than their body can get rid of. And essentially it's that overflowing cup analogy where if you just keep pouring fluid into a cup and don't empty it, essentially it's going to overflow. If the patients are producing lots of histamine but can't degrade it really well for numerous reasons, then they're going to have excess histamine, which is going to create symptoms for the patient. And the symptoms could be quite varied. The patient could have skin symptoms like itchiness and rash and urticaria and hives. They could have cardiovascular symptoms like arrhythmia and low blood pressure. They could have symptoms that affect their sleep, so they may have problems falling asleep because histamine can stimulate the system. They could have any number of GI symptoms. They could have brain fog and fatigue and vertigo and headaches and migraines. So there's lots and lots of symptoms that somebody can have as a result of having excess histamine buildup. But it's not that histamine is bad. We need it. It supports the gut. It supports the GI tract and the GI system in proper digestion. It supports a healthy immune response, and it supports the nervous system. So we have to have it. The longer you're doing functional medicine and the more you learn about histamine and histamine intolerance, the more you're going to realize that many of your patients, especially those that have leaky gut issues or food sensitivities or food intolerances or migraines, have histamine intolerance. You know, a classic symptom that a female will typically tell you is that she has really painful menstrual cycles. She gets a lot of pain, or that she has headaches or migraines sometime near during her period of ovulation, and then right before the beginning of her menstrual cycle. So we're going to spend probably, 5-6 episodes of Methylation Monday on just covering some of the nuances of histamine and histamine intolerance. So review this if you have to, and then look forward to the next episode of Methylation Monday, where we'll get a little bit more in depth into some of the nuances of histamine and histamine intolerance. All right, take care.